Thank you, everybody, for coming back after lunch break. For those of you who were not here in the morning, we started our presentation going over our goal as a network, our goal as a center. And it's, for those of you that were here in the morning, quality, okay? If nothing else, let's learn that today. Okay, so we're here to achieve quality. Brian went over the measures. How do we achieve quality? What are the institutions that are measuring us? How is that being measured? And then we went over the workflow. How do we get there? How do we achieve quality? Well, we analyze the current workflows and we redesign as needed. Finally, we need to make sure that we have the right team in place. Wendy went over the team that we have to have in place as a whole. We are part of the team. We're part of the team with our centers. We all have to work in conjunction to achieve
quality.
Coffee?
Coffee.
No. Okay. Quality, okay? So, once we have
Quality.
once we have the goal in place, or workflows in place, the team in place, we need to start looking into our configurations, our key system configurations. It's not the beauty of the building you should look at, is the construction of the foundation that will stand the test of time. What does this mean? You might be doing everything right, the center might be doing everything right, but if the system is not configured properly, then you're not capturing the quality measures that we need to be capturing. So we're going to go over some of the mini process analysis that you should be doing at the centers in terms of setup. We're going to go review some key system configurations, some setup preferences to improve workflow, and some parts of EHR configuration. And Brian is going to join me a little bit later on in this piece of the presentation. So, before we dig into the system, Intergy system configurations, we as a center and as a network, we need to look at our security measures. What securities do we have in place? HIPAA has a group of safeguards and rules that need to be in place in every health system. Why? Because in our hands we have the health information of thousands of patients. We are responsible for that information, and the patient deserves their privacy. So, setup is important when we're looking into security. What are the major threats that we have to security right now? Password sharing, and you'll be surprised, it happens. They're in a hurry, people are in a hurry, you know what, use my account. What happens when that is done is whatever somebody else is putting under your name is going to be recorded onto that person's name. And there's no way for you to prove that somebody else used your system to enter any type of information. Off-site access to EHR systems. This might not be an issue for centers, where some of the employees just have access to the system when they're in the office. But it is an issue for the network, because a lot of us have access to the system information outside of our office. Staff turnover. If there isn't a process in place when staff is changing and moving and leaving the place, that's another risk. And unauthorized access. So, when it comes to security and the security that we have in place, we're going to follow HIPAA regulations and rules, and they have three main safeguards. The first one is administrative safeguards. That has to do with what are the processes and procedures that you have in place at your center. The second one is physical safeguards. That talks about locks on the doors, actual physical workstations, computers, who has access to the computers, who have access to the doors, to the offices, things like that. And technical safeguards is what do you have in the system in place to make sure that all the information is saved securely. When it comes to administrative safeguards, the centers, we invite the centers to do a mini workflow analysis. And when they do that, the first thing that they need to look at is what are the risks that they have in their centers. So like I mentioned to you, every center is different. So if it's a small center that only has one location, then the risk analysis for them, it's going to be different than a center that has 3 different locations, or if it's a center that has a building with 3 floors and every floor has different services. The risk analysis for each center and for each community health center is different. So the first thing they need to do is do the risk analysis as to how it affects them. In our case, the risk analysis, and we all know, we all been to all the security trainings, we have to do it for access outside the office. We need to do it for access outside office hours. All of those are risk analysis that we need to be analyzing. What are the risks that we have at this moment? After we do that, we implement policies and procedures. For example, if one policy and procedure is staff members can only access the system from 9 to 5, then that is your process and policies and procedures, okay? And that's what you have in place, that's what you train, and that's what you tell your staff. For those of us that don't like to follow the process and procedures, you need to have a sanction policy in place. There's always going to be those that are not interested in following processes and procedures. And if you don't have a sanction policy in place and other staff start seeing that the policies and procedures are not being followed, then your entire security management system is at flaw. Okay? Finally, one thing that you need to keep coming back is to reviewing your risk. If you open a new location, you need to reanalyze your risk. If you open new access to the system, you need to reanalyze your risk. So this is an ongoing process. When it comes to administrative safeguards, the best way that we recommend for the centers is put in place security groups and security roles. That way, for example, what is the thumb of rule? The rule of thumb for HIPAA is you give each person the minimum access needed for them to perform their job. So you need to ask yourselves, what access does this person need to perform their job? Some centers, they have front desk, as I mentioned before, printing referral summaries at the front desk. So they have access to EHR. Front desk has access to EHR. Some centers, they don't have front desk accessing the Intergy EHR system. So if that's the case, in that center, if the front desk needs to have access to Intergy EHR, they put the security group in place and they put the roles that each one of them is going to have. This is an example of how they should be thinking about it ahead of time. This has to happen before you hire staff. This has to happen before you put anything in place. Know your security groups and know your roles. Once you hire somebody for the front desk, for billing, for whatever job responsibility and description you have, you already have this in place, and the only thing that you need to do is assign it. How do you assign it? You need to have security access to practice administration. You're going to access set up and access and practice administration, user start securities, and then you're going to assign the security groups and the roles that are needed for that person. Have this process in place before you have new hires. Now we talk about the physical safeguards. All of us have seen those movies where if somebody is trying to get information about a patient, they send somebody else to distract the clerk, correct? While the other person is getting the information. Well, that is a physical safeguard that is lacking. So when we go into centers, we're walking around, we're seeing, okay, that's a nurse workstation and I can read the information from where I am. That's the problem. Something that I mentioned to the centers is, as we all were made aware during our security training, is if you have the patient information, meaning name and date of birth, your data gets sold for a certain amount, correct? But if you have the name, the social security, the date of birth, the address, the zip code, then that data goes for a lot more, okay? So now I say to you, how much of that information can be accessed from the patient summary window? For those of you that are familiar with Intergy. All of it. So leave your computer unlocked for 5 minutes with access for anybody outside and see how much data they can collect in those 5 minutes. You should try it as a test and you'll see that the risk is high. What do we do in terms of physical safeguards? We make sure that the workstations are not accessible to private people that are not part of the center. And we all familiar with these ones? Yes? Has anybody here gotten one of those crazy emails? Okay, it happened to me twice where I left my computer unlocked and somebody in HCN sent some of those emails on my name. It happened twice, it didn't happen again. I'm still looking for the culprit for the second one. Okay? After that, this has never happened to me again. This is in a funny way of telling you, but in reality, when we go into the centers and we see all these computers unlocked with all the patient information available for anybody, then it's actually a very serious topic. And then we have the technical safeguards that we already know that Citrix expires or passwords every 3 months. And if you're like me, you wait until the 10th day to change your password, that you get a notification. What is it? How many days you get to change your password? Okay, last time I went into the last second. But those are the technical safeguards that the system has in place to keep your information secure. Okay? Once we're able to analyze our security access and security risk, we go into some of the key system configurations. When it comes to quality assurance, we need to make sure, and for RCM sites, RCM takes care of that, but we need to make sure that the procedures are set up as UDS visits. How does the system know that whatever service is being performed by the provider should be counted or not in the UDS reports? Well, this is how the system knows. You go into Setup, Procedures and Profiles, Procedures, and then you look for the procedures that should be counted as face-to-face interaction, and you make sure that they're set up correctly. Okay? Another part of the system that every center should be checking that is set up properly for UDS is setup, financial, and all of these tables need to be reviewed. The sliding fee schedules, the poverty guidelines, Medicare clinic rates, and Medicaid clinic rates. If this is not updated, for example, poverty guidelines is not updated, then when you're doing your sliding fee calculations, you're gonna be making wrong calculations. The discounts are gonna be wrong, the reports are gonna be wrong, all of that information is wrong, and like Brian mentioned earlier, what comes out in the reports is what you put in. Okay, so look at this piece. The next thing we want you to review is your UDS setup. So yes, the reports have been moved to Practice Analytics, but the setup is still being done in Intergy. Okay, so we want you to go into Setup, CHC Reports, UDS Reports, and review what you have set up for your staff. Make sure that the staffing category is selected, and that if that person, that staff member, does not to be included in the report, then they're set up as exclusions. The same thing for insurance plans. You all know that insurance plans are coming every day we have a new insurance plan. That's okay as long as we have somebody in the center accountable and responsible for coming into these tables and making sure that they're mapping the insurance plans to the correct selection. And as you can see in this setup, it tells you exactly what tables is affecting in your reports. Table 4, table 9D. Again, for centers that have been with us for a very, very, very long time, this list on race and ethnicity gets long, very, very, very long. What's important here is that whoever is responsible for UDS setup goes into this table and maps each one of the descriptions here, the race, to what UDS requires. Okay? And finally, we want to make sure that you go into the other and review that the bad debt codes are set up and the adjustment codes are set up. Again, it tells you there what table is affecting on your UDS setup, UDS reporting. Okay? The next piece that we have here is some little tips and tricks on helping the end user flow, go a little bit faster. So we want to make sure, and a lot of end users don't know, that they can actually customize their toolbar. They can actually come here, options, user toolbar, remove all the icons that they don't use. So if you're, for example, you're front desk, most likely you work from this icon, which is the check-in window, and you should have this icon as one of the first ones that you use. Now, if you're a billing person, you're probably going to be working more with claims and payments, so move those icons closer. Customize the toolbar, customize the system to what works for you. That makes it easier. Now, these sections and this customization is by user. So whatever you do is going to be changed only and only for you as a user. Another thing that a lot of centers and a lot of end users are not very aware of is that when you go into the patient information window, you can actually reorder these pages. If you are at the front desk, you're most likely touching the personal page, the imaging, sliding fee, privacy, and others. So make sure that you move those up. That way you don't have to be fishing around and looking for what is it that you're accessing. You're working with the patient, you're registering that patient, you make sure that you have your pages organized in the way that you usually work with those patients. You don't have to be trying to figure out where is my next step. To do that, you go into the patient information window, you click options, page order, and when the menu opens, using these side arrows, you move them up or down. Similar to the big toolbar, you can actually customize the mini toolbar that you have in the patient information window. Again, options, user toolbar, and take out, if you don't have to deal at all with prescriptions, take out those icons and make it easier for you as a user. Okay? This one we want to pinpoint here. Why? Because SOGI, for those of you that are not familiar with what SOGI is, sexual orientation and gender identity, as many of us know, are two fields that UDS is now requesting. Now, again, every center is different. Some centers do not have the front desk asking this information from the patient. Some centers have the MAs or the nurses asking that information. But if they do have the front desk asking this information, then they need to give us access to that. For that, they require security permissions, so they need to make sure that they go into the security user and they have access to these fields. And in order for them to be able to view it without having to do an extra click, they go into options, desktop, use larger windows. That way, they're going to be able to see the SOGI fields, sexual orientation, gender identity, and actually they can also see the IDs and insurance cards if there is anything scanning there. Okay? Another piece of the practice configuration that we want to emphasize when it comes to quality measures, we know, because we know our measures, correct, because now we made familiar that there's certain fields in the registration process that are required, okay? We know which fields during registration are required. So we use the system to help us. We come here, let me go back, I'm sorry. We go to Setup, Administration, Practice Configuration. We look for the registration fields, and we make sure that all of the fields that are required for UDS reporting are set up as required. That helps the end user, that stops the end user from bypassing those required fields. So again, make sure you use the system to help you acquire those measures, okay? So make sure you go and review all of your required fields for patient registration, and you set them up in the system as required fields. Once we're done reviewing all of our practice management setup, we move into the clinical piece.
Thank you very much, Sandra. Kind of a different turn this afternoon, right? Talking about securities and system setup and stuff like that. So just like Sandra mentioned not too long ago, kind of understanding how it all ties back when we're referring to quality. This certainly has a lot in terms of the impact on quality. And one of the main things that we got out of this whenever we were talking to the centers is, when was the last time they actually went into a user's account and updated their roles and responsibilities? They were hired as someone, and over the years were promoted, or their roles changed, right? So think about how that can impact security. Think about how that can impact quality in terms of how you use the system. Yeah, this is not an information security risk class, but if you've done the research, you'll know really quick that your health information is worth much more than your social security number and a credit card. So think about that. So yeah, there's a reason why we're starting here in terms of the foundation, because just as Sandra put it, the way that this system is built is something that is also part of that PDSA cycle, right? Is also part of that data quality management process. It's not just what we're doing when we're capturing measures. It all happens to do with the way that we're using the system, and it starts with a setup. So yes, workflows will impact the setup, which is why we have to go through some of these things just to at least get you to go into the system and review some of the setup that's in there. Because I know a lot of us in here are really not users of Intergy every single day, and I know most of us in here already know what I'm about to refer to here. This is a classic example right here, and I know that we have had this discussion many times in terms of LOINC codes. You know, the simple fact that someone goes into the system and they begin to track, I'll use an example of INRs, okay? Someone begins to track INRs, and all of a sudden they decide that they want to put it in electronically, and they add it. Beautiful. Now I'm able to now track and trend, you know, certain lab results in the system. The challenge is if the network does not have any notification or they're not aware of certain lab results that are being tracked manually in the system, we don't know what ID is associated with that manual lab unless you notify the network. So there should be processes in place as well when we talk about system setup before you actually go in here and add a lab code that impacts our UDS measures, right? Very important. So yes, in terms of where you actually go in and do this, this is just a simple overview of where you find that information in terms of lab maintenance or labs information. So yes, in terms of PAP test, HbA1c, right? Colorectal cancer screenings, FOBTs, or your FIT test. This is where this information needs to be tracked. So this is, again, making everyone aware that when we're talking about tracking labs, we're not saying go into your note and put the result in. The result has to be put in manually. There is a lab result entry process when we talk about system configuration and making sure that the mapping, the LOINC mapping, is also there. EHR configuration also continues in an area that we're all very familiar with in terms of challenges with reporting on immunizations. So as you can see here, this is another key area that really has an impact on quality, because the immunization setup is really is an area that needs to be streamlined. And I know that we're already talking in terms of immunization setup, where we need to be, right, conceptually, in terms of making sure that all centers are using some sort of standard format when it comes to capturing our immunization information, right? So here's an area where actually the system keeps all that information in terms of all of our vaccines that are on file, our schedules that are created, and all the details associated with each one of those vaccines. Primarily those ones impacting shot registries, right? So this is an area that when we think about quality and the impact, or I should say setup and the impact on quality, is another area, just like we talked about LOINC codes, where we need to ensure that all these attributes that impact, right, quality in terms of tracking quality measures is actually set up correctly. So yes, there are other tools in place where you can go onto the CDC website and you can bring down the associated CVX code and the procedure code associated with the individual vaccine. However, this is an area, like I mentioned, is being looked at in terms of ensuring that there's some level of standardization across the board. Now, just like Sandra just mentioned, there are also preferences in the EHR as well. So very similar to rearranging the pages during registration, you can kind of do something similar in the EHR. So yes, you can rearrange navigation buttons. You can rearrange the patient chart so that it's actually maybe arranged in a way that is kind of part of your thought process in terms of how you see a patient or what's the first thing that you look at. So yeah, there are some preferences that I'm going to go into as well. And a lot of that has to do with being able to optimize or kind of streamline the process when tasking. Because as you know, Intergy does generate a lot of tasks, especially when you're ordering labs, right? Ordering referrals, things of that nature. So how can we make this process a little better in terms of managing that workflow? So yes, in terms of tasks, I'll touch on that in just a moment. But here are two areas that are really key, because what we see here a lot as well, in many cases, is recent encounters, and that impacts how you manage your day in terms of approved notes. So there is a way where I can actually change the look or the view of my day or my provider desktop when I log into Intergy, so that I'm looking at all notes that are still open. In addition to that, there is a way where I could actually redirect the orders and charges tab when I transition into that process. So for example, if I'm ready to put my treatment plan together, drop my charges, order my labs, we can kind of change the thought process to make sure that we're capturing those performance measures, but that our mind is focusing on that rather than jumping right into writing a prescription or ordering a lab, which is typically what you would see in a regular workflow. So by changing the option to, for example, looking at the predictive order management tab, as soon as you go into orders and charges, the first thing you see at the top left, if you arrange those windows properly, are my performance measures. I immediately know what procedures are tied to those clinical findings when I was using the quality measures form or the clinic team form. At the same time, if you have that defaulted to predictive order management, I can write my script, order my lab, capture my office visit, all on the same screen. Okay, so that's a recommendation in terms of how to default that page when you're in orders and charges. Now, in terms of workflow and optimization, here's an area at the top here where you see order type, right here. So all order types and Intergy can be directed in multiple areas, right? You may order a lab that goes to your lab techs. You may order a referral that goes to your medical assistant or maybe the referrals department, right? You may order an in-house procedure that goes to my nurse or an immunization that goes to my nurse. So because of the variation, you could actually set the system up to send those tasks automatically to those areas, whether you're using a pool or you have a specific care team that you work with. You can set the system up with favorite users, right? That way, every time you order a lab, the system already is predefined in terms of where that task is going. Same thing with your referrals and your procedures. Down here at the bottom, this is more of an awareness topic, or just as an FYI for those that actually venture into that folder there. That's just an area letting you know the default guideline set that the system is using to make decisions in terms of the health reminders. So really, what we're referring to here is where it says HCN Health Guidelines, right here, which is the current guideline set. We're making sure that when users go in there, one, they're not changing things. They're making sure that it doesn't say HCN Health Guidelines set. Because what happens is if you're not pointing to the right guideline set, then it's going to impact how the system is making decisions to your health reminders. So you may not be referring to the most current health management guidelines. So there are some other preferences too. We were just looking at a couple under general, but if you look here, there are some additional encounter note preferences that the system also has available to the providers. This is largely the one that impacts them the most. And because many health centers have steered away from citing because of the impact on clinical history, we've kind of made sure that they understand that clinical history does need to be managed from the patient's chart. Or when they're updating problems, they need to make sure they update clinical history, not annotate the notes. By annotating the note, reversing the clinical history, deleting the clinical history from the note does not update the patient's chart, right? Everything you write on your note basically is saved in your note. So the great thing about using site defaults is that it actually speeds up time during the documentation process because the providers can bring in current medications, allergies, all the past medical history, right? They may choose to bring over advanced directives, and if they're using the care team, it also gets saved into their note as well, which is actually pretty cool. So yeah, this is an area, especially this top part, okay, that is extremely important. I referenced this top part here because if you're using the care plan that's tied to the problems list, right, you could actually leverage the system to include the care plan when I'm citing over my problems. So patient returns 3 months from now for a diabetic follow-up, and you cite over the history, the plan that's associated with any change you make to that particular problem gets thrown into your note. So you don't have to retype your plan all over again. And in terms of health information exchange, that information appears on the visit summary and is exchangeable in terms of utilizing the care plan the right way. So here's an area where, again, when we talk about setup, the impact on not having access to the most current procedures. This is also another area that doesn't get touched quite often as it should, especially if centers are using a favorite procedure or diagnosis list. Typically during an implementation, securities are set up, right? During an implementation, the E-encounter is set up, right? A lot of things are done in the beginning in terms of setup, but are never revisited. You may have procedures in that E-encounter list that are never used or no longer offered as a service. You may have new services that have been added to the clinic, right? We need to go in here and make sure that the procedures associated with that E-encounter are always up to date. And I know there's a different workflow in terms of RCM centers, but again, it's an area that is is really important in making sure that that list is up to date. So here are just a few steps that pretty much just really, this is just an overview of how you update those favorites in terms of updating the procedure list associated with that favorite, as well as a diagnosis list, if there is a diagnosis list tied to that favorite as well. In addition to that, there is an attribute, there is a configuration parameter inside of the provider's maintenance file where you take that favorite, that e-encounter, and you tie it to the procedure's profile, so to the provider's profile, so when they're in orders and charges, the system already knows which e-encounter to look at in terms of the services for that location. Although this may seem a little bit fundamental, there is actually a setup, a gear, a cogwheel, a configuration tool so that the users could actually change the way that the chart looks. Not just the way the chart looks in terms of the patient summary, but the navigation bar here on the left, right? The tools that you have here on the navigation bar. The reason why we bring that up is because a lot of times, staff are using small laptops, and maybe then they transition into an exam room or office space where they have a much larger screen. So it may not be an issue for those who are using a larger screen, but if you are still one of those pioneers using a small tablet, you could only see a handful of those buttons, tops 10. Okay, and a lot of times they're going to the bottom down here and they're doing what? They're hitting more, right? So, it kind of takes time, and we're always calculating the number of clicks, right? And ways that we can minimize that. So yeah, why not just rearrange that navigation bar? Absolutely. So if you're noticing that your allergies is always down here, then bring it up, right? That's the whole idea. Just look at your top 10 buttons. Because most likely you're going to see the top 10 regardless of what kind of computer you're using. At minimum, you'll see those top 10 navigation buttons showing at the very beginning of your chart. So in addition to that, I did mention that you could also arrange the middle portion of the patient summary, right? This portion right here in the middle. So as you can see, it's limited. There's not a whole. There's only so much information there you could actually remove or rearrange. But the idea here is to make sure you've got the main things, right? Your care team, your problems, your medications, your allergies, your open orders, your tasks. Make sure you have all that stuff in plain view, in whatever arrangement you want. But at minimum, make sure that you have those things in the areas where your mind wants to see them. Again, that's a user preference, but it's a good thing to know that you could actually rearrange this information here. In addition to the Today panel, there you only have 4 options. So that's the information that shows up right under, right? The encounter information and the vitals. Right under that, you have listed out what? Today's vitals, health reminders, the immunizations that are due, right? And under that you have tasks. So that one, you really don't have much to change there, but you can move those up if you want, up or down. So that was just a quick little overview on the importance of making sure that when we talk about quality, that we're also revisiting our users and users and security in addition to system setup. And then what we're going to talk about now is, or in just a moment, we're going to take a little break here and we're going to talk about change control and onboarding and some thoughts we have on that. Thank you.